All right. Well, why don't we go ahead and get started, and then anyone can join us if they like. So just a quick disclaimer, this presentation is offered for general information purposes, not to be relied upon as medical advice or for diagnostic or treatment purposes. A little bit more about me. I'm a pediatric and family chiropractor, which I think I'm the only chiropractor here at this event today, which I'm excited to share more about chiropractic and the results we see in our clinic, which is why I was invited. I lecture internationally, both within the profession and also to the public on this topic, as well as autism and neurodevelopmental disorders. My focus in my practice is on helping people with neurodevelopmental challenges, such as autism, ADHD, PANS. My own son has a diagnosis of PANS, which is a pediatric autoimmune neuropsychiatric disorder. So I'm intimately familiar with chronic health challenges. I'm the Autism One Pediatric Chiropractic Continuing Education Program Director, which we started last year. That's a continuing education track for chiropractors. And I'm also the Vice President of the International Federation of Chiropractors and Organizations. And so the reason that we see the changes in the results, which I'm going to share a lot about in a moment here. The reason we see these changes in my practice is because I start with a different paradigm. I start with this belief system, this approach that believes that you actually are designed to be healthy and not sick. All right, what do you guys believe? Do you believe you're designed to be healthy or sick?
We deal naturally.
Yeah, we're designed to be healthy. We're designed to be happy. These are the essence of living organisms. And so I have a salutogenic approach from the Latin for health and creation of. So instead, the last 17 years of my career, I've studied what it means to be healthy and what it means to how to improve health and not treat symptoms or disease. And so when people come to my practice, I don't diagnose people with anything. I don't diagnose epilepsy. People come to me with a whole list of different diagnoses, but I'm not adding to that list, nor am I concerned with diagnosing those situations. What I'm looking for is how do I restore health? How do I return normal function within my specific healthcare profession? So today's presentation is going to be filled with information from various authors, researchers, peer-reviewed, published articles, and textbooks. And when it's my opinion, when I'm presenting cases, I'll let you know. But this is going to be packed with information and research here. I don't know if we have audio. We'll see in a second here. Can you hear that? Nope.
I think it's coming out of the projector.
Yeah.
It's a little bit louder.
It's okay. I'm going to share Liam's story in a second, but this is Liam's mom's, Beth. I met Beth at an Epilepsy Foundation meeting in San Diego at a chapter meeting that I spoke at. And what she's telling you is that she couldn't believe that her son went from having 60 seizures a day to 0 in 4 weeks. And he now is 5 years seizure free. And so I start my presentations with his story and her story because I understand that people have an understanding and impression of chiropractic as a treatment for back pain and neck pain, for musculoskeletal complaints. And that is not how my profession started, nor is it the extreme value that it holds for mankind. It actually is in restoring balance to the nervous system, removing interference to the nervous system, which we're going to talk about mostly today. So we're going to be talking about some clinical cases. We're going to be talking about dysautonomia, which is a big word for an imbalance in the autonomic nervous system. Are you guys familiar with the autonomic nervous system? Have you learned much about it on your journey so far? So we're going to go into that today. And then we're going to be talking about heart rate variability, what the research shows us. Heart rate variability is a way to measure and track the autonomic nervous system. And then other potential mechanisms that are likely involved in these cases that have improved. So this is from the Epilepsy Foundation website. It says that the human brain is the source of human epilepsy. And my question to you is, does the human brain develop in a vacuum? How does the brain develop? We need to start to look at it not so much from just a simply pathological problem with the brain, but perhaps the brain is just not functioning properly, or perhaps it's actually functioning quite properly given the total environment of the body itself. Another way to look at this is, instead of from a pathological perspective, more of a functional perspective. Why would the brain, well, let me take a step back. Remember, I said I believe that the body's designed to be healthy, not sick. And I think you all agree with that, right? Anyone not agree with that statement? Now, how many of you, else do you believe? Do you believe that your body's designed intelligently, that there's this amazing intelligence in it, or do you believe it's quite dumb?
We learn over time, so
Yeah, we learn all the time. That's our educated intelligence, but I'm talking about an innate intelligence. The kind of
Our body is healing itself in ways we have no clue.
Yeah, I'm talking about this amazing intelligence and this wisdom in the body that knows how to heal a broken bone, that knows how to digest your breakfast, and we don't have to educatedly think about it, right? That's happening all for us at every moment. So why would the brain ever create a seizure? If everything is working intelligently, why would it create a seizure? And so I look at it from this perspective. Perhaps that brain just can't simply handle the information in its environment. Or perhaps there's some if you think of it from a computer perspective, perhaps it's being bogged down by information. There's too much, you're losing memory. You don't have enough memory to handle the programs. The body cannot process information in its environment, and it's almost like a reboot. This Control-Alt-Delete. If your computer gets stuck, you have to reboot, do a hard reboot of that computer. And so that's how I often look at seizures. So this is some information I've been putting together. I'm putting together a case series from individuals that came into my practice with a diagnosis of epilepsy. I didn't diagnose them. They came with the diagnosis. Various types of epilepsies. And so I compiled 20 cases, and these are some of the results. This is what we found. So of 20 cases, 6 of those had complete resolution. Okay, that's 30% of that small sample. Significant improvement with a 50 to 75% reduction in seizure frequency was seen in 10. That's 50% of the sampling. Slight improvement, 10 to 25% reduction was seen in 3 of the patients, and then 1 patient there was no change. And so between significant improvement and resolution, this was an 80% change for these people. Now we saw these changes in grand mal seizures, partial complex seizures, absence seizures, atonic seizures, and we also had many genetic cases, people with Dravet syndrome, Tay-Sachs disease, CDKL5, and these people, all of the genetic cases, they all had significant improvement. Their seizures didn't resolve, but they all decreased significantly in intensity and frequency. And for those cases that had complete resolution, one case was 3 weeks, another was 4 weeks, 6 weeks, 8 weeks, 12 weeks, and 32 weeks, with an average of those 6 people of 10 weeks care, and typically seen at a frequency between 2 to 3 times per week. This is one of the cases, the individual, Liam, that I was talking we were trying to watch the video but couldn't hear the sound. This was Liam. He presented he was 3.5 years old when he came into my office. It had started 9 months prior with no known cause. He was having up to 60 drop, absence, and grand mal seizures per day. Most of the seizures were drop seizures. During that time, he had gone to the ER twice in the first few weeks of care because he had fallen and hit his head and cut his face, lost a tooth. And we started to see seizure frequency start to decline within the first week of care, but by 4 weeks, seizure frequency was completely non-existent. His family and he went to Atlanta. They went on a vacation for a week. He had 1 seizure while away, and then came back, got back under care, and had never had a seizure again. He's now 5 years seizure-free. When they were told that his EEGs and MRIs would never look normal, and he would have seizures the rest of his life. And this was he was on multiple medications. Now these are some of the studies that we do in my practice, and these are his specific studies. This is a paraspinal thermography scan. It's looking at skin temperature on both sides of the spine. It's known that skin temperature on both sides of the spine there should be within about 0.5 degrees. So any higher imbalance will show up on these scans as either green, which is a mild increase in temperature difference, blue is moderate, red is severe, and black would be super extreme. You can see from his initial scan, All this red indicates severe inability to regulate his own body temperature. Okay, that is controlled by your autonomic nervous system. Your autonomic nervous system controls your fight or flight response versus your resting, healing, digesting response. We're going to talk a lot more about that in a second. His follow-up, now I told you in 5 weeks he was seizure free. His scan on 10/22 though, he was still under care because this is a corrective process. Just because the symptoms are gone doesn't mean that the neurological process, the imbalance, is gone itself. And so that's why we track and monitor this through his thermal scans. You can see on 10/22 is much less. He had multiple scans in between 10/13 and 3 of 2015. I didn't put all those just because it was a lot of data, but you can see a marked decrease. And this scan, what you're seeing is a state of balance. Now I've also added that scan on the far left is a heart rate variability scan. I didn't have that technology when I first saw Liam. I've since added that. I wouldn't practice without it, actually. And this is, we want to be in that green zone. That green zone is the known normal state or optimal state of autonomic balance, okay, an autonomic nervous system balance there. This is Balam. Balam came, he actually came from Africa. He came to San Diego for the best care that the United States could provide. He was under multiple medications, but his seizures continued. He was having 15 to 20 grand mal seizures and also absent seizures per day, mostly absent seizures, but he was having, I think, 1 to 2 grand mal seizures per day. His seizure frequency started to decrease within the first few weeks and then resolved after 32 weeks. He's since been seizure-free for 2 years. So what is chiropractic? We need to, and what am I doing? We need to start by looking at the anatomy, function and anatomy. This is the upper cervical spine, the back, you can see the back of the head there, and then the top vertebrae, which is known as the atlas bone. This bone is very different than the rest of the spinal anatomy. It's very flat. There's cup-like shapes to allow your skull to sit on it nicely. And this bone has the most range of motion out of any of these spinal bones, so that we can have function, so that we can turn and look and move our head. But that also means that it can misalign more readily due to traumas, physical traumas, stressors, even birth traumas, things like this. We need to understand that the spinal cord travels through the spinal column. We often forget that. Why is the spinal cord encased inside the spinal column? Why do you think it's encased in bone? For protection, right? This is the most important organ of the body, our central nervous system. Our brain is encased by the skull. Our spinal cord is encased by the spinal column. Also, our main blood supply to the brain, the vertebral arteries, travel up in the spinal column itself. There's holes for it, and then it wraps around and goes up into the foramen magnum, which is translated as big hole. This is where the spinal cord and the main blood supply and also the cerebral spinal fluid travel through. So just another visual of the brain blood flow. Would you argue that it's important for the brain to have proper blood flow? Yeah, right? It's extremely important. So this is how our brain gets blood to it so it can actually function. Just a visual for you here, your central nervous system, the brain, the spinal cord at the very top is your brain stem. That's where most of the processing of information occurs. And our spinal cord and brain is covered by something called the meninges, which is a fibrous tissue that covers and protects the spinal cord. It provides cushioning for the brain, and that cerebral spinal fluid circulates within it to not only protect the brain and the spinal cord, but to provide nutrients to those tissues and to take toxins out of that system. So this is what chiropractic is concerned with. We're concerned with something known as a vertebral subluxation. It's a misalignment of a vertebrae. It happens most commonly in the upper neck due to the unique anatomy of that region. It can happen in other areas. However, this is the most important location because of what I just described, the spinal cord traveling through at that location, the main blood supply, and also the cerebral spinal fluid. So here's some things we know, and I'm going to go into today. Scientifically, we know that a subluxation can cause dysautonomia, okay, an imbalance in the autonomic nervous system, basically taking someone out of a balanced state of physiology, neurophysiology, into a stress response, into a fight or flight state. It also can impact the blood flow to the brainstem and or brain, and it can alter the cerebrospinal fluid flowing to and from the brain, and it can cause tension in the spinal cord itself. Okay, the spinal cord is much like a guitar. Okay, if you take a guitar and you start to tweak the neck of the guitar and put extra tension or too little tension in those strings, that's going to change the vibrations, it's going to change the expression of that instrument, and our spinal cord actually attaches not only at the very top but all the way down the spine. And if there's extra tension, loss of curvatures, we have 3 curves in our spine that should always be there for strength and stability, then that's going to alter neurological function. This concept is actually not a new one. It's been known for centuries, for thousands of centuries. In fact, there's a whole system known as yoga, which has been very intimately concerned with and aware of the importance of the spine and its role in human health. Yet, as a society, we have vastly overlooked this extreme importance of the structure affecting the function of our bodies. So, since we're talking about blood flow, we're talking about the autonomic nervous system, we're going to take a look at some research and see what's happening when people are having seizures, what's happening with blood flow in the brain. I'm going to show you 3 studies. We're not going to go deeply into the studies, but basically, we know that there's an altered state of blood flow during seizures, but also before seizures. In this study, they found that convulsive seizures were associated with a remarkable increase in the blood volume. Which makes sense if there's a lot of activity happening in the brain, there's extra demands. But absent seizures were associated with a mild decrease in blood flow. Another study also finding that the cerebral blood flow measured also in the middle cerebral artery significantly decreased during these spontaneous absent seizures. And this interesting statement here, neurogenic control could also influence cerebral blood flow. So basically that this blood flow could be affected by the nervous system, specifically the sympathetic and parasympathetic systems. That's the autonomic nervous system. So we're going to talk a lot about here briefly. One more study, again looking at the cerebral blood flow. And this is what they said: although focally increased at the onset of a seizure, this blood flow may be temporarily inadequate to meet the metabolic demands. So to meet the demands of the brain, both outside of the seizure event and during the seizure event. So meaning that these individuals are likely not getting the proper blood flow, not only during the seizure, but out at other times when the seizure isn't occurring. So here's what we know when there's a misalignment of the upper cervical spine, the upper neck. This is from this textbook, The Craniocervical Syndrome and MRI. They're looking at functional MRIs. So an MRI, a standard MRI, is a static moment in time. A functional MRI is dynamic. It's looking at brain activity, and it's looking at flow of the vessels. And so what they found is that these misalignments can cause neural compromise, meaning pressure on the spinal cord, and or may contribute to cerebrospinal fluid obstruction or the blood supply compromise. Interesting to note is that these misalignments may also cause a backup of the cerebrospinal fluid, causing the cerebellum, the back part of the brain, to start to go down into the foramen magnum. Okay, and so oftentimes the procedure is to do a surgery to try to open up space there, but they're finding that this may be leading to that cerebellum coming down into the brainstem, further choking off the cerebrospinal fluid. And this I just found, this is from a new book coming out called Hydrocephalus, Water on the Brain. They're talking about a decrease of the cervical spine curvature. So most of us do not have optimal curvature due to various stressors. One of the most common stressors is sitting for multiple hours and doing this, sitting in chairs. We develop what's known as a forward head posture. They've actually done studies on forward head posture, and they found that our life expectancy actually decreases with every millimeter of forward head posture. And it should make sense because our spinal cord has to travel down through that. The authors concluded that it's the wearing and tear on the spinal cord that actually leads to that decrease in quantity of life. And so they're finding that when we lose the curvature, that's going to create traction and tension on the spinal cord itself. And again, these misalignments of the upper neck can impair the normal cerebrospinal fluid flow, as well as contributing to an insufficiency of blood flow of the vertebral-basilar system, so the system that supplies blood to the brain. Now, this was a small pilot study in chiropractic and adjusting the spine. Now, realize we don't have the luxury of receiving grants from the government to do funding. We have to do funding ourselves for our studies. So we haven't had any large study, hopefully until now. Part of my goal in being here is to create a pilot study looking at this topic of chiropractic and epilepsy. So if you know individuals who would be interested in participating or being part of that, let me know. So this study, though, found that there was a transient but significant change in the middle cerebral artery blood flow in those people receiving a chiropractic adjustment. So while it was transient, it lasted for a short period, there was a significant change in the blood flow in the middle cerebral artery, the artery that provides the brain with much of its blood supply. This is also on the topic. This was a larger study. This was done in 2007. It was in the Journal of Human Hypertension. It was on the news because of the significance of it. They found that adjusting the upper neck, adjusting the atlas bone, had on average a drop in blood pressure. People with high blood pressure had an average drop of 14 points in systolic and 8 points in diastolic blood pressure, and that change stayed for an 8-week period. And we conclude that the restoration of atlas alignment is associated with a marked and sustained reduction in blood pressure, similar to the use of 2-drug combination therapy, meaning normally it would take 2 drugs to have the same effect as adjusting the upper neck in these situations. So now to the autonomic nervous system. We talked about blood flow, we talked about cerebrospinal fluid flow. This is where I think it's likely impacting the majority of people, however, and this is what the research shows in terms of how people are being impacted that have epilepsy. This is our autonomic nervous system. It's also, I call it the automatic system. We don't have to think about eating, breathing, all these different functions. They happen automatically. We have 2 sides to that system. One side is known as your sympathetic system. Okay, that's also known as your fight, flight, or freeze response. You guys know what I'm talking about, the fight or flight response, right? Most of us are actually living in it in our modern day society, and especially as caregivers or an individual with epilepsy, we know scientifically that your body is more in a fight or flight state. So is that sympathetic response good or bad? I hear good, I hear bad. Yeah. It's good for running away. It's good for when there's a danger, but it's not good if there's a perceived danger. You know, if you are afraid of spiders and your spiders all around you all the time, you're going to be in a chronic state of fight or flight. However, it is good if there's a truck coming at you and you need to jump out of the way, because what happens, our heart starts pounding, our adrenal glands secrete adrenaline to get our hormones going, and then we spring into action. Blood leaves our digestive system and other organs and moves away from even our prefrontal cortex, where we have executive functions, to our reptilian primitive brain, and so we act more instinctually. We're also not very concerned with exploration or it's only survival in that moment. So what's the danger of staying stuck in a fight or flight state of physiology? What's going to happen? Fatigue. Anxiety, yes. Low immune system. Breakdown of the body, because the other side, once that danger is gone, we should go then into the parasympathetic system. This is the resting, healing, digesting, and development side of our body. This is where we're not focused on survival, but on thriving, exploration, social engagement. In fact, many children with autism, other neurodevelopmental disorders, are in massive fight or flight. If you're in early fight or flight and you stay stuck in that state, then you'll see the signs. The signs you'll see in eyes darting around the room, dilated pupils. They're in survival mode. They're not getting into the higher levels of brain organization, development, social engagement. So it's a huge situation. So I asked the question: is epilepsy really a syndrome of dysautonomia? Even the word epilepsy is a word we use for someone who's having seizures that we don't really know why it's happening, right? And so perhaps it's happening because the body is just in an imbalanced state. So dysautonomia is a dysfunction or imbalance in the autonomic nervous system. The tendency is to go towards a decreased parasympathetic activity and an increased sympathetic. So increased fight or flight, decreased parasympathetic. What is the primary driver of our parasympathetic nervous system? What nerve? Where there's a huge movement, to address this in epilepsy, because the vagus nerve, our vagus nerve. So our vagus nerve travels where? Where does it start? Starts in our cranium. It's a cranial nerve. We have 12 of them. It's the 10th cranial nerve. It travels down through our neck, right? And so it goes to all the different organs. And I'll show you in a second just how that works. But this vagal tone, this heart rate this autonomic nervous system balance can be measured. It can be measured by something known as heart rate variability. Anyone have a heart rate variability scan at all? So heart rate variability is being used in the research, but for some reason it's not being used vastly clinically. And it really, really should be. This is not only in epilepsy, it should be used at by every primary healthcare professional or provider. So heart rate variability it's a simple and accurate test to measure. It's measuring the intervals between heartbeats. Okay, we don't want our heartbeat to be like a metronome where it's just like do-do, 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 do-do. Our heartbeat should be constantly fluctuating. It should have high adaptability, because we have countless demands on our body constantly, just in all the processes that are happening inside of us, even in this very moment. So our heart rate intervals should be highly variable, okay, and that's controlled by your autonomic nervous system. Now, the research shows that we have a diminished or lower heart rate variability in pretty much all chronic diseases, epilepsy, high-risk arrhythmias, and especially in sudden unexpected death in individuals with epilepsy. This is something we should be really, really concerned with when we're talking about epilepsy. So again, low heart rate variability equals an increased sympathetic activity, and when you have a higher heart rate variability, that means that you have a better, healthier parasympathetic activity or vagal tone. So here's some of the literature specifically around epilepsy and heart rate variability. So this review of the literature, so this is looking at multiple studies. They said that we confirm and extended the hypothesis of sympathovagal imbalance in epilepsy, as low vagal tone and high sympathetic tone are predictors of morbidity and mortality in cardiovascular samples. And I said our findings highlight the importance of investigating autonomic function in patients with epilepsy in clinical practice. And this is where there's a disconnect. We're not currently looking at the autonomic function of patients with epilepsy. So this other study, they also looked at this topic. Their conclusion was that the results indicate a detectable, sudden, and inordinate shift towards sympathetic overdrive in the sympathovagal balance. So again, this and two more studies, same information. Basically, people that are experiencing seizures have a lower heart rate variability. They're in more fight or flight physiology. Okay? So here's our vagus nerve. Vagus comes from the word wander because this is a very long nerve, and it wanders through our thoracic area. And so it innervates and provides balance to the organs of digestion, our heart, lungs, all these different organs. And we shouldn't be concerned with it solely with epilepsy, because here's what the research shows. It's involved in pretty much any major disease process, even what we call mental health challenges, depression, anxiety, right? Somebody mentioned if you're in chronic fight or flight that you're going to experience anxiety. People come to me all the time with this diagnosis of anxiety. I ask them the question, well, perhaps you don't have anxiety, but perhaps you just have an anxious nervous system. See, it's something we're not really thinking about. We're not thinking about it functionally. We're thinking about it, unfortunately, from a purely pathological perspective. These are more studies all looking at this vagal tone, heart rate variability in rheumatoid arthritis, lupus, multiple sclerosis, Alzheimer's disease, fibromyalgia, chronic fatigue syndrome, and also Parkinson's. All of these these different conditions all having low heart rate variability. And it should make sense. If we're in fight or flight, that means we're not repairing. Our body is breaking down. So this is Caitlin. Caitlin came to me several years ago. Her daughter was having, Lana and her daughter Caitlin. Lana's daughter was having partial complex seizures. After her first visit, she was having seizures multiple times a day. She didn't have a seizure for the entire week, and in 3 weeks she was seizure-free. One of the things to note in this case is that she had had an injury, a low back injury, where she bulged a disc when she fell and landed on a trampoline, on the edge of a trampoline at a party. And after that, she couldn't bend further than this, and she was walking on her tiptoes, which unfortunately the parents were told this was a behavioral thing that the child was doing. And then when she started to have seizures a few months later, that the seizures were completely unrelated to this back injury. Now, they knew that this child was having a bulge, which meant that there was extra tension and traction on the spinal cord. If you have traction down at the bottom, that's going to create traction at the top. As we started to take care of this child, adjust her spine and restore normal function to her spine, her seizures went away, and they haven't come back. This is Ariana. She also has a diagnosis. She has a genetic condition. She has Duchesne's syndrome, and so she has a genetic component. Now, a couple of things. One, in these cases, oftentimes, especially with genetic situations, as I mentioned earlier, in those cases, we don't often see the seizures go away completely, but we do see a significant decrease in intensity and frequency, which we saw for this child. But we also saw, as the mom describes, it was almost like an awakening, like seeing this child finally start to open her eyes and interact with her world. And it should make sense. She was in massive fight or flight. She was stuck in development. But if you look at the picture, she's not looking at the camera. We see multiple structural imbalances. If we look at her shoulder heights, we look at her arm lengths. One arm is lower than the other. We look at her knee and her pelvic position. This child is showing the manifestations of chronic upper cervical imbalance, upper neck imbalance. When we have an upper cervical subluxation, upper neck imbalance, we don't walk around like this. Our body is extremely intelligent and wants to try to release tension on this area as much as possible, so it will compromise other areas. We also have a reflex that wants our eyes to be parallel with the horizon, and so our body will do this. One shoulder will get higher. It will lead to compensatory stress patterns in the spine and eventually lead to things like scoliosis and pelvic imbalances, pronation of the feet, the legs going in. This is being vastly under-recognized at this point in healthcare. More heart rate variability. This was a small study looking at individuals using drug therapy. And here's what they said. They said that control of the generalized seizures was accompanied by a simultaneous increase in parasympathetic regulation and a decrease in the sympathetic. So many of the drugs are actually working because of the shift in the autonomic nervous system. And that's what they said. The reduction in sympathetic regulation is the proposed benefit of many seizure treatment models. Okay, so they're looking to get that body out of that fight or flight. So I thought this was interesting. I share this with people all the time. If you listen to Mozart, it can actually decrease your seizures, according to this study, and it's due to the increase in parasympathetic tone. It helps, right? It's very calming, it's very relaxing. It helps balance that body. So why not listen to Mozart, right? My dad made me do it growing up. Right? Stress is a trigger. We know that stress increases seizure frequency, right? And it should make sense. If you're in fight or flight, it means you have low adaptability. It means you cannot handle your environment, both internally and externally. And so more stress, more seizures. Now, my question to you is, what makes more sense? Should we try to limit people's life experience and try to limit their stress exposure? Or should we increase their adaptability and their ability to be resilient and to engage and be part of life? And so that's why I look at this from a functional perspective of increasing the size of your bucket. Your nervous system is your bucket for stress. And if you're stressed out, that stress comes in, right? And if you have a healthy nervous system and you're eating well, you're getting enough sleep, you're doing all these different things, then your body will dissipate that stress. You'll actually use some of that stress for your benefit, like gravity. If we don't have gravity, our bones break down. We actually use gravity to build our bodies up. And so the thing is, if our sympathetic nervous system is dominant, we're not getting all that stress filling up every day is not getting dissipated. You're just at this high stress, you're at this threshold where the seizures are going to happen more frequently. And I think that was the case for Brett. Brett had 2 diagnoses. One, he received a diagnosis of epilepsy at 20 months, but he also received a diagnosis of autism spectrum disorder at 2.5 years old. He was having up to 800 seizures a month. You can imagine what that was doing to this poor child's brain. And he was in massive fight or flight. When I first saw him, he was hiding under the table, his eyes darting around the room. He was very much like a caged animal because he was in massive fight or flight. And over time, we saw a reduction by 95% in his seizure activity. Now, in this case, his mother was also utilizing CBD, and she believes it was a combination of both forms of care that was helping him. But I want to show you some pictures. This was a before picture. Notice the head position, right? And if you go back and you look at even some of your children's or your own pictures and look at head position in a lot of your photos, you'll often see things like this. And then this was him after, and before he never smiled. He had a lack of emotion on his face. One of the biggest changes was socialization, and he's now able to speak. He wasn't speaking previously. This is another child, but I thought this was a good time to show you this. Take a look at what happens when I add these lines. What do you notice with the structural alignment of the earlobes, the shoulder heights, the winging of the scapula? What you're looking at, and even the torque of the pelvis, what you're looking at is the physical representation of stress in the nervous system. Okay? When that nervous system is stressed, it then pulls the muscles and torques the spine and presents with all these compensations. So what about chiropractic and heart rate variability then? Okay, because this is what the research is showing. Upper neck adjustments of the upper neck, enhances the dominance of the parasympathetic system. So it increases that vagal tone. And adjusting the lower cervical spine increases sympathetic activity, because there's different areas of the spine that control different parts of the parasympathetic or sympathetic nervous system. This is why the upper cervical spine is so important. This is a literature review. I just added this. This is from 2018. They looked at multiple forms of manual therapy. There's different professions that do this type of work. Chiropractic, obviously, osteopathy, some physical therapists who do upper neck manipulations. I don't particularly like the word manipulation. I use the word adjustment. An adjustment is very specific. These manipulations, it says, when manipulation is performed in the cervical region, the parasympathetic nervous system is activated due to the response to the vagus nerve. Right? These are 3 more studies. These are looking all at heart rate variability, and all 3 of the studies came to the same basic conclusion, that a healthy autonomic nervous system balance is found after correction of the vertebral subluxation. These subluxations interfere with the normal neurological pathways. And it really shouldn't come as a surprise. This has been known in the literature for a long time. The concept has been challenged by current systems that don't recognize this. Now here's the thing. This was a paper that has over 800 peer-reviewed reference articles, and they said there appears to be extensive, if not overwhelming, evidence as to the potential for a manual model for positively influencing the autonomic nervous system. And through that, internal pathophysiology and symptoms. Basically, the spine influences the autonomic nervous system, and we can influence it by restoring function to that system. This is one of the ways that we measure. I've shown you already, but basically a paraspinal thermography scan is looking at skin temperature differences from side to side. This particular scan was showing massive amounts of interference or inability to adapt. This is a specific case here, 20-year-old female. They started as grand mal seizures at age 18. She was on Keppra and folic acid, which reduced it to 1 time a month, and it transitioned into absence seizures. Now here's the thing, if I go deeply into the histories often enough, I'll often find this. She had a prior history of chronic migraines and headaches several times a week and severe fatigue. Those are signs and symptoms of an upper cervical subluxation. Okay, decreasing cerebral spinal fluid flow, affecting the nerves that go to the head. She increased seizures with increased temperature. What does that mean? Stress, right? More stress, the more it increased her seizures, and she was very spacey, and she couldn't focus well. She couldn't go to college, which she wanted to do. This was her initial scan. She had a 4-degree difference in her upper cervical spine on the left. This is her follow-up scan 6 months later. This is what a healthy scan looks like. She had in that 6-month period, she had 1 absent seizure, no more headaches or migraines, increased energy, not as tired, and increased focus, no more spaciness, and she was able to start school. So really, we need to start to look at chiropractic not about pain, but about the brain. And this is, fortunately, we're able to get more studies like this one now. This study looked at a PET scan of the brain. They looked at individuals with subclinical neck pain, and what they found is that when we adjust the dysfunctional joints in the spine, a subluxation in the neck, that it changes how glucose is metabolized in the brain. Basically, the brain is working more efficiently after an adjustment. And if we think about it, if there's interference, that means that brain is not understanding exactly what the body needs. We remove that interference, and now the brain can have a clearer picture and understanding of what it needs to adapt to life situations. They also found lower stress levels, increased quality of life, decreased muscle tone, and decreased salivary amylase, meaning that, so this is a change in autonomic nervous system function. And they said that these changes are due to regional cerebral, these changes in the glucose metabolism are due to changes in the sympathetic nervous system, relaxing that system. Here's another study. This is what type of study was this? This was not a functional MRI study. This was a somatosensory evoked potential study. They're looking at how the brain is registering information and where when we adjust the spine. And they found that when we adjust the upper neck, when we address the subluxation there, it would actually activate the prefrontal cortex. So we're finding that we already knew that chiropractic was impacting the brain. Now we're understanding that it's specifically affecting even areas of the prefrontal cortex, which were involved in higher cognition and executive functions. So what does the epilepsy and chiropractic literature look like? It's pretty sparse. There isn't a whole lot of information. It's mostly case studies at this point. And this is how we do research. We present case studies, we present information, and then we do pilot study, and then we do a larger double-blind clinically controlled study. But in this literature review, and this was back in 2001, I know that there's additional cases in the literature now. 17 reports of pediatric epileptic patients. These were people who were on medications but not getting results. And they all had upper cervical care, or 15 of them did, and they all had very significant positive outcomes. So when I give presentations like this, I give them in my community, I give them across different parts of the country and world, I always include this slide. The last thing I want people to think is that chiropractic is a treatment for epilepsy, okay? A treatment for autism, a treatment for anything for that matter. Because I'm not looking to treat or diagnose symptoms or disease. What I'm looking to do is look for one source of interference, a very common and a very real and impactful source of interference that could be interfering with your body's natural ability to heal, grow, and thrive. That's what I'm looking for. That's what chiropractors should be looking for. And this is what we found when looking at people under what's known as asymptomatic care. People like myself who have been receiving chiropractic care for the last 25 years after I had my first chiropractic experience and just noticed that my body worked better. It worked better in sports. It worked better in school. I was much less irritable. So this is what other people have found though, and this is in the literature. People with no symptoms had improvements in their autonomic function, their hormones, their cardiovascular function, immune system, muscle strength, athletic ability, heart rate variability, range of motion, reaction time, neurocognitive function, information processing, visual acuity, reproductive hormones, general health of senior citizens, and reduced labor times. So what is chiropractic really? It's a method to restore function to the nervous system, optimal function, allowing you, your family members, your loved ones to experience the best health and quality of life that you were designed to experience. It's really that simple. Absent seizures. 32-year-old female, sudden onset during her second trimester. She had never had seizures. She did, however, if you go down to the 2 lines, she had a chronic history of migraines. Any of the ladies have children here? All of you? When you're pregnant, is that a easy experience? It's a what? It's a very stressful one, right? Physically, emotionally, chemically, lots of changes. My belief is she already had a subluxation. She had an upper cervical subluxation, and the birth or the pregnancy process put extra physical demands on that upper cervical spine and contributed to these seizures. I have video of her telling her story, but this is her surface EMG scan. I didn't talk about this. This is another way we track this. We don't always use this for children because they move too much, so they need to be pretty still for this test. White bars are considered normal. This is looking at the electrical activity in the muscles that support and stabilize the spine. We have known normals of activity. White is considered normal level, green is mild increase, blue is moderate, red is severe, and black is extreme. For reference, we rarely see black. Okay, she had extreme amounts of imbalances in her system. This is her follow-up scan 5 months later. A little different, right? A lot better, more normal. This is her initial thermal scan. I rarely ever see black on a thermal scan. She had a 12.6 degree difference in her upper neck, which is one of the highest I've ever seen. And this is her follow-up scan. Still red, 2.4 degrees. However, after one adjustment, she never had another seizure again. However, at 5 months here, we're still in a corrective phase. Even though we're supporting her body and making the changes so that this pattern doesn't come back. When someone is trying to stop smoking, what usually sets them off to start smoking again? Stress, right? What we're talking about is a corrective process. We're talking about a structural corrective process and a neurological corrective process. We have tight ligaments, tight muscles, we have weak muscles, we have neurological pathways which are perpetuating this pattern. And so if we don't do objective measurements, if we don't, because, and I can tell you from experience, I used to practice without some of these objective measures, I potentially would have discontinued or decreased frequency in care too early because her symptoms went away, her seizure went away. However, the pattern, her old pattern from years and years ago was still very much present, even at month 5 here. And I think this is the last case here that I'm going to present. This child, she presented at 7 months old. She had CDKL5, which is a genetic condition. Seizures typically start at 2 to 3 months. Hers started at 6 weeks old. She was having them constantly. Pre-medication, she was having 8 to 15 seizures daily. Post-medication, she was down to 1 to 2. But she had extremely poor control of her head and neck, eye movements. She had astigmatism, so she couldn't focus on anything. She was extremely fatigued and sleeping constantly. Her thermal scans, I couldn't find hers, but she had extremely high readings in her upper neck, and this was her follow-up. After 6 weeks of care, her seizure frequency went down from 1 to 2 per day to 1 every 2 to 3 weeks. And however, the biggest changes were in increased motor control too, greatly improved ability to focus the eyes. That was one of the first things we saw. Her eyes were able to focus. She became alert. She was interacting with others, and she was no longer sleeping the majority of the day. So, how do you find a provider? This is extremely important. My profession became very splintered early on in our history, and so chiropractors. Many don't have objective measurements when it comes to taking care of the spine. So, number one, they should be vertebral subluxation focused. Some are focused more on nutrition, some are focused more on functional medicine, some are focused more on sports therapy. Those things all have value. However, specifically, if you're looking for someone who knows how to detect and correct a vertebral subluxation, then they should have that on their website. They should be talking about that and have that in their office. They should have objective measurements, some of the different testing. They may not have all of these, but they should have some sort of objective testing to measure nervous system responses. Heart rate variability is one of them. Not as many offices have that. More and more are starting to get it. EMG to measure the electrical impulses along the spine, paraspinal thermography, and or X-ray are all different ways that this can be assessed and measured. They should have experience seeing more difficult cases. That's important that they have experience seeing that. Many chiropractors focus on acute back pain, neck pain, so they should have more experience in more difficult cases. And if it's a pediatric case, they should definitely have additional training and expertise in taking care of children. My practice is 65% kids. Lots of other offices are out there like that. Some of the places where you can find a chiropractor that would fit this sort of requirements, ifcochiro.org, chiropractic.org, and icpaforkids.org. I'm also very happy to help find you a referral in your community. You can email me at that address, or you can come speak to me after the presentation. I'm happy to stay around as long as anyone needs me to chat. So as I mentioned, I'm very interested in doing future studies. I'd like to do a 30-person study looking at the functional MRI, EEGs, heart rate variability, thermography, surface EMG, X-ray, all these different testing. Looking at probably 36 visits over the course of probably 2 to 3 months, and documenting those changes and seeing where we go. So if you know anyone who would like to participate either as a researcher or as a future participant in the study, come let me know. I'd be happy to chat with you about that. With that, thank you very much for your time and attention today. I'll be around afterwards to take any questions, and I really appreciate your time and attention. Thank you. And if anyone wants to, I'm happy to take questions here if anyone has any questions as well.
Do you want to adjust these personally? Because I already have this one and I've only it's up on like 7 visits, so I can just provide you information.
Potentially, I think unfortunately, with research, they would probably there's going to be criteria, and probably it's going to have to be someone who wasn't already under previous chiropractic care.
Yeah, I already have one that's about the X-ray and then I tried doing everything.
Mm-hmm. Okay.
And then the post at 36 and 72.
Potentially, we'll definitely, we can talk more about that. Yes.
What about the autoimmune system? If it got aligned, would it help with the autoimmune system?
Does it help with with autoimmune situations, and it would help with the immunity? We have some preliminary data that chiropractic influences the immune system. And really, we should look at it from a systems top-down perspective. Your nervous system is the master system. It controls all function of the human body, orchestrates and controls all of the various systems, the immune system, detoxification systems. They all interact together. However, if you positively influence and remove stress from the nervous system, then we should expect to see changes in other systems. And so many people with various autoimmune type situations have seen improvement with chiropractic. Now, we need to ask ourselves a question. Remember, we start with the premise that the body is intelligent. So why would it ever do anything to attack itself? This is a tough question for a lot of people. I don't have any problem answering it. See, the body does everything intelligently, including that situation, which is actually for an individual's survival. Okay? One of the primary drivers that we're seeing today with autoimmune situations is gut-brain dysfunction, gut-brain axis imbalance. And so the gut is highly involved in the majority of human chronic disease. And so if you have what's known as a leaky gut, if there's an imbalance in your gut, your digestive system, allowing undigested food particles, toxins, bacteria, viruses, things that normally would be excreted and not allowed into the bloodstream, the body is going to have an intelligent response to that. Its intelligent response to an invader is to attack it, to create inflammation. It leads to a chronic inflammatory cascade, and that will often then produce what we call an autoimmune condition that is basically a chronic inflammatory cascade that then throws off the brain and the immune system. It's a vicious cycle that can be broken and beat. My son, who has an autoimmune encephalitis, he's about 90% recovered, all through natural methods, and there's many other people who are doing similar recoveries. Yes.
Is the case studies the case studies were they only focused on kids or adults?
Some of those were adults.
And also were they grand mal?
Many of them were grand mal. Yeah, many were grand mal. Majority were either, so I'd say, I think about a third were grand mal, a third were like absence, and then partial complex.
And were they adults or kids?
I don't know the exact ratio. Majority were kids. However, several of the last two studies I showed you were adults, a 24-year-old and a 32-year-old. There's also a 23-year-old in my, currently under care in my practice. Yes.
Can you help with scoliosis issue?
We've seen improvements in scoliosis. We've seen changes in scoliosis. I see that many times. It depends on the child's age or even adult age. I have a 91-year-old woman with a severe scoliosis that we're seeing significant improvement in her how she's able to stand up straighter. We don't have any pre or post X-rays, but she's significantly improving in both her posture, energy, and quality of life. Yes.
When you were showing some of the pictures where there was the imbalance, they were always shifted and always seemed like it was to the right. I mean, can it be a shift either way, or is it primarily the right?
It can be either way. Yeah, I wouldn't say I don't have any good data on it being one versus the other. Yes.
Just yesterday I read an article about a lady when she was younger, she had a lot of seizures, many per day, but while she watched Mr. Rogers' Neighborhood, she didn't get a seizure. And it was just the calmness. So it goes along with what you're talking about. And in that same magazine, someone put in a comment on how meditation helped that person not go through seizures when they had the aura and they knew it was coming up.
Yeah.
Just meditation, breathing, and basically getting into that relaxed state. This person not to actually seizure itself. Also, I'm working with the DO that does a lot of massage, a lot of just, I don't know if it's adjustments, but my son loves going there and he just relaxes. And the other day I went through a little bit of a scare because they started taking Jericho for the seizures in addition to the other medication. And I forgot to give it to them at the time. It was a day he didn't have school, so at 2.5 hours later he starts crying and he was really stressed. That's when I realized I forgot the medication. Give him the medicine and he's looking at me like he needs to help me, like he was in such stress response.
Yeah.
I didn't know what to do. I just remembered relax. And we happened to be a pediatrician for other people, so I saw his hands, his feet, relax, and almost fell asleep.
Yeah. Yeah, definitely there's numerous studies showing that if we can increase parasympathetic tone, then we can decrease seizure frequency. The challenge would be, as I mentioned, there can be venous, arterial, and cerebrospinal fluid flow issues as well that are contributing to it, and not simply the autonomics. So those are, I think both areas need to be addressed too. Thank you guys. I'm going to step outside, and I'll be outside if anyone has any other questions or wants to talk personally too. Thank you very much.